Berdasarkan data yang dihimpun Satuan Tugas Penanganan COVID-19 per hari ini 8 September, terdapat penambahan 3.046 kasus sehingga total kasus COVID-19 di Indonesia adalah 200.035 kasus.
Disturbing videos on social media appear to show the extreme measures taken to control the outbreak. Here, workers in hazmat suits detain a young couple, putting them into a metal box. A child's voice asks why. The adult answers because they're sick.
Hello everyone, I'm Jiestiari from Group A. Before we start reviewing the vaccine, let me introduce my group members. My name is Made Jiestiari, my absen number is 29, and my friends there are Putu, Indah, Handayani, Artha, absen 30, Nyoman, Pryo, Sattwika, Sukma, absen 31, and Putu, Cintya, Vidya, Nidhi, absen 32. And now, I will explain you about our orientation. COVID-19 or coronavirus disease is a newly discovered disease found back as early in 2019 by a newly discovered coronavirus. Since then, the virus has spread worldwide and has killed dozens of people. All the world, including Indonesia, have against coronavirus almost in a year. To protect ourselves from that virus, we get a vaccine. Sinovac vaccine is the first vaccine that will be given to everyone in Indonesia. That vaccine was produced by China. In Indonesia, Sinovac vaccine has cooperation with Bio Farma to produce a COVID-19 vaccine. President Director of Bio Farma, Handayani, said that Beijing-based company's coronavirus vaccine has passed phase 1 and 2 clinical trials. However, the vaccine is still in testing before it can be given to everyone.
Good morning, Miss Era and my friends. My name is Indah and I want to explain the evaluation paragraph of Group 8's review text. In Indonesia, we are using Sinovac vaccine produced by China because it was being tested into phase 3. Before it was being tested on human, it was first being tested on animals, and the result was provide safe and graded immunes. According to Professor Kusnadi, the Sinovac vaccine is the fastest and the most usable now into the productive 18 to 59 years old society. Some countries agreed to use this vaccine because it was cheap and easy to transport. From the beginning of the year, there have been 2 particular variants that have been reported to World Health Organization, and it was identified in the UK and in South Africa. This new variant do tend to spread faster. They are more transmissible, and they are more infectious. But the virus have the pretty similar kind of disease with the previous one. According to Dr. Somya Saminathan, World Health Organization's chief scientist, the scientists now are still learning and still observing about the SARS-CoV-2. Most scientists believe that the vaccine that is currently in development and the couple of that have been approved should provide protection against these variants. And the change of the virus should not make the vaccine ineffective.
Hello everyone, so I'm going to continue the video by explaining my part from the review text. So, according to the BBC News, results show that the Sinovac vaccine has been very effective against the virus. Researchers from the Butantan Institute, which has been conducting trials in Brazil, announced that the Sinovac vaccine had 78% effectiveness against mild to severe cases. But this doesn't include patients who have very mild cases but doesn't need any medical treatment. If they did include those patients, the number will go lower down to 50.4%. But Butantan researchers insist that the Sinovac vaccine still had 78% effectiveness to prevent mild cases that does need medical treatment and 100% effectiveness towards the more serious infections. However, in Indonesia, researchers found that the Sinovac vaccine had 65.3% effectiveness. From people's experience, like Sri Purnomo, the Sleman governor, who had been injected by the Sinovac vaccine, shortly after he was injected, he contracted COVID-19, though this case doesn't relate to the vaccine itself. But multiple sources stated that they haven't found any side effect from the vaccine, and they still believe that this vaccine is still in testing and trial phase before it could be given to everyone else. But we still believe that the vaccine should be the major solution to this pandemic. But people in Indonesia, not all of them obey the health protocol. Therefore, the virus in Indonesia is still spreading fast. And we still don't know if the vaccine had any potential deadly side effect that could harm our body. That's it from me, and the next part will be explained by my friend.
Based on the explanation above, it concludes that Sinovac vaccine is safer, cheaper, and easier to transport yet. It's still trial phase before it can be full use by everyone. Also, we can share yet about the effectiveness of the vaccine itself. We think that the Sinovac is need more time be fully developed, and since we know no dangerous side of effect, it's still safe for use now.
Yeah, so that's it from our video. I'm going to close the video, and before that, I'm going to say thank you very much, especially for Miss or anyone that watching right now, for spending their time to just watch our video. And if we did make any mistakes in the video, we are very sorry for it, and yeah, we are very thankful that you watch our video.